Well, what a pleasure. I'm joined now by the Executive Director of CSIH, Janet Hatcher-Roberts. Janet, welcome.
Thank you.
Thank you very much for joining us.
Oh, it's our pleasure.
So Janet, tell me a little bit about the aims and objectives of the organisation.
Our focus is really on equity-oriented health system strengthening. And so we serve as one of the significant voices in global health in Canada. And we have two strategic goals. The first one is facilitation and enablement. So this conference is part of that strategic goal, where we bring people together, not only in Canada, but people from all over the world. Over 40 countries are represented at these conferences. And we try to focus on a theme. This year is global health. Is it a humanitarian crisis? It allows other groups to gather and use this conference as a nexus for their meetings and their activities. The second area is technical assistance. And we have got significant support from CEDA, the Canadian International Development Agency, Public Health Agency of Canada, Health Canada on projects, Institutes for Health Research, and IDRC. But increasingly, because of the challenges, the economic downturns, there isn't readily available money, especially core funding, and many NGOs have suffered in Canada as well as, I'm sure, globally.
So Janet, how has the downturn affected CSIH as an organisation?
Well, it is, I would say that the economic downturn probably didn't affect CSIH and maybe not either some of the NGOs as much as we would have thought, but it probably related effect has been the tightening up of government and their ability to give grants and funding. And so in their call for accountability and transparency and good governance, everything's kind of tightened up. So in the last year, there have not been very many calls, competitive calls for proposals, for example. So we've really had to look outward, and we partner with organizations outside of Canada as well. And that's good. It's caused us to reach out more than maybe we have in the past, although we've always been big on partnership, and to seek like-minded organizations. So in a way, that's been the impact of it. It's been positive.
So what does the future hold?
There's two areas we really want to get better at. One area is our outreach with our members, and that includes students and that includes young people. We want to help prepare young people to be good global citizens and to be aware of the issues and to be able to work and live in low and middle income countries. So that's something we really want to work on. And we want to diversify our sources of revenue so that if something happens here, then we're balanced with some other sources of revenue. And that's a challenge which will continue to be a challenge. And our goal of diversification will always be a challenge, and so we'll never totally reach it, but we will always be striving to reach out in partnership as well as revenue diversification.
Janet, thank you very much indeed for joining us on Global Health TV, and I hope you have a great conference. Thank you.
Thank you.